It is my pleasure to introduce Amber McCall, an adult diagnosed with Gorham-Stout disease, and Michelle Layman, an adult diagnosed with Generalized Lymphatic Anomaly. They're going to speak to the unique challenges of adults with CLAs seeking care. The title of their talk is The Odyssey, Adults with CLAs Seeking a Medical Home. Welcome, Amber and Michelle. Amber, if you could start by telling us more about you and your diagnostic journey and some of the major challenges you encountered as an adult with CLA.
Yeah, thanks, Dr. Kelly. So welcome, everyone. I'm excited to be here and kind of talk a little bit and share what it's like to be an adult patient with GSD. So my diagnostic journey really began when I was a little girl. I spent a lot of time in the nurse's office at school with migraines. And so we kind of tried to figure out what was going on, and I encountered doctor after doctor who really just wasn't sure what to tell me or even what was happening. I had a lot of testing done. I remember lots of MRIs and CTs and eye tests, and none of them really led to an answer. So my entire life, I kind of just went along, not really knowing what was happening. In my early 20s, I spent a week in the hospital. I was diagnosed with meningitis for the second time. And they did a number of tests there because they knew something other than meningitis was happening, something underlying, but they didn't know what. And so they tested for everything. I mean, tuberculosis, STDs, cancer, et cetera, et cetera. At the end of my stay, I had an MRI that they noticed something that they had missed in the past. So they saw this kind of protrusion at the back of my head. And that was when I was diagnosed with Chiari-2 malformation. And so if you don't know what that is, my brainstem was hanging below my skull. And so there was pressure on my brainstem. And so we kind of thought that this was what had been causing my migraines. So we decided to move forward with surgery, and I had decompression surgery a month later. And during that surgery, the surgeon actually found that my spine was riddled with holes. So more questions. They didn't know why or what was going on. And so they sent my pathology to a lab, and I was finally diagnosed for a disease that had affected me my entire life. And so after I got that diagnosis of lymphangiomatosis, I did some research, and in my research, I found the LGDA, which I was really grateful for. And they led me to Dr. Kelly. And I've told him this multiple times before, but the day that I met him was one of the best days of my life because I had gone through all of these years of doctors that really just were confused or didn't know, or maybe were misunderstanding me, et cetera, et cetera, et cetera. So I didn't really feel heard until I met Dr. Kelly. And I remember he asked me, tell me everything that you've experienced, whether it's small or seems weird or strange. And so I kind of talked through my symptoms that I had experienced over the last 22 years. And after each one, he kind of nodded and confirmed that it probably was related to lymphangiomatosis, which is what it was called at the time. And so I was so grateful for that confirmation, and just really felt so relieved that I finally had something to go off of, right? I finally had a doctor who knew what I was experiencing, and not only that, but also why I was experiencing those certain symptoms. So that diagnosis was helpful. Some major concerns or challenges you asked me to talk about too. So a couple of things that I face as an adult, because I wasn't really diagnosed until I was an adult, which is a bit unusual for this disease, but I've been working to find a primary care doctor that really is willing to work with me and my oncologist and my team. And that's hard to do. Some doctors just aren't willing or not able to kind of put in that extra effort to research, because that's another thing. I am kind of the expert in the room when it comes to my disease. And so sharing information with doctors is kind of a weird reality to be in when I know more about it than they do. And so they're trying to learn, but also help me make decisions that are going to benefit me as an adult patient. And so that's kind of been strange as well. And so over the years, I've worked with several doctors, and like I said, trying to find one that's willing to kind of be part of the team to take care of me. And really also trying to find an adult oncologist, which I know we've talked about is kind of a difficult thing right now in terms of finding oncologists that are prepared and aware and knowledgeable about our diseases and able to help us as adults, and that can follow me. And then really just another challenge that's kind of unrelated to treatment, but something that I've struggled with especially is the inability to be really active or do repetitive motions. I've found that when I do things like work out or garden, I will most likely face neck pain as a result of that shortly after. So just really being aware of my body and what it's telling me and kind of trying to slow down a little bit compared to maybe how I've reacted in the past to certain things as a 3-sport athlete, et cetera, et cetera. So that's just kind of a quick snapshot into the adult life of a patient with GSD.
Well, thank you, Amber. That was thank you for sharing your story, and obviously a very compelling story, and unfortunately one that we hear a lot. So Michelle, again, please, we would like you to share your diagnostic journey and share any unique challenges you faced as an adult with CLAs.
Hello, everybody. My name is Michelle Layman, and I wasn't diagnosed till almost 4 years ago. And it all started with a blood clot in my thumb, which is super rare on its own. And whenever I had already seen an oncologist because I had a few late miscarriages. And so he went and he was listening to my heart and he heard a different sound to it than he had ever heard before. So they decided to do a CT. When they did the CT, they found a huge mass. There was actually ended up being multiple, but he only did it on my chest at the beginning. But he had found a softball-sized mass, and it was sitting 3 millimeters from my heart and touched my left lung down my diaphragm. They thought it was lymphoma, which they did a biopsy through a CT, and then they did all kinds of other things. They ended up trying to take it out, I ended up in the hospital for 21 days on life support. From that, it took till I think it was 5 days after I woke up that they were able to figure out what it was, but I got the diagnosis of LAM. So we went to Lisa Young at Vanderbilt. And she said, she looked at it, she said it's a pathology, she said, they have messed up. It's even more rare than LAM. So then we got sent to Cincinnati. When I went to Cincinnati, I think it's Dr. Hamill there. And they didn't agree with the lymphangiomatosis, even though my pathology said it was, because they didn't see how I was as old as I was and never diagnosed. And so I ended up, they said there really wasn't anything they could do for me. They tested every genetic avenue that was possible. I had pretty much any kind of test you could ever imagine done, and they all come back negative. And they sent me home. So then I looked up Dr. Adams because I know that Dr. Young had told me about her. And I emailed her personally. She looked over my things and they sent me to Boston. They did more testing there and they confirmed it was GLA at the time, in which I had them in my kidney, spleen, lung, a few places they can see on my head. I had it in my chest, and then I had maybe 1 or 2 on my spine, but not very many. But she said that she did not think that any treatment would work for me at my age, that it would really shrink them that much. So she said they would just keep an eye on it and kind of watch it. Well, we came back home and I started having more problems. Like my back was hurting all the time. I couldn't stand up. I could do heat, I could do cool. I went to our local orthopedics and they could not really figure out what was going on. So I ended up going to Dr. Blatt at UNC. And that team there has been amazing. They have helped me. I was on Rapamine for a while, and now I'm starting a new trial. The first day of it is October the 25th. So we're in the process of all the testing and all that. So I have started that. The challenges. I've had lots of challenges. One is finding a doctor who will treat you. Because being as old as I am, and I had a clotting disorder, that was another reason we had so many miscarriages. One good thing is that my blood clots had worked to kind of stop the tumor from growing on one side of my body. So it had calcified, put blood clots in calcified, which was also kind of made it more of a medical mystery. And that made it harder for people. So that's why we had to hop around to different places. Then I know that I had a PCP that we absolutely loved. I actually graduated high school with him. He is amazing. But one time when my chest was hurting to the point, it had hurt for about 2 weeks, and I just couldn't stand it anymore. It hurt to breathe, stand up, move my head, do anything. He was out of town, so I went to another local doctor who sent me to UT. That's our biggest hospital around here. And they had done a scan. Well, when the scan came back, it showed that it had progressed. But he did not, he was mad at me because I went to another doctor, so he dropped me as a patient. So then I ended up finding another girl. She lives very close to me. She's my regular PCP now. And so she's right there. If it hurts, she knows, because I do not go to the doctor unless I'm in pain. It has to be major. And then so she'll take care of that. Or if my breathing. So I've luckily found an amazing one, and she talks to all my other doctors. My other hardest thing is where it sets on my heart, because now it's 2 millimeters from my heart. Being able to find a cardiologist for a while that would work with my PCP and my pulmonologist and my neurologist and all those people have been a headache. That's kind of my biggest things. We did have a recent scan that showed that it was involving my spine a lot more than they originally thought. And I now have multiple lesions on my spine. So we're waiting to kind of figure out what we're going to do about that. We're hoping the new medicine, the Piqray, will help. That's kind of our first step. But I guess that's my story. I did notice things when I was younger, because I used to have a lot of chest pain. My arm had swelled up and they had to drain it one time, and it was a yellowy fluid that came out. We didn't know what it was. I was put on steroids for a long time, finally stopped. They had always done echoes or x-rays every time my chest hurt when I was younger. But a lot of things as I got older, it led up to it. Like we always wondered how I could break like I would always break these last 3 fingers. We never figured that part out. And it could be over simple things like I shut the door wrong. And the doctor's like, well, you're just clumsy, you fell. But I live in a very small town, so that was probably a big part of that. But now I have a little more understanding. And just like Amber said, when you go to the doctors, it's interesting when you're normally teaching them more about your disease. I do have a book that I have given my local oncologist, and then I have Dr. Blatt. So if anybody has any other questions, they call her. So that has been a lifesaver too.
Fantastic. Thank you, Michelle. I really appreciate that. And again, I think you have highlighted a number of unique challenges that adults face, and not only finding good primary care, but also subspecialists that are aware of this particular disease. So thank you for sharing. So in the last couple minutes, if you could just let us know how the LGDA, your doctors and researchers can help improve the experience of adult patients like you.
Yeah, so I can start with that. A few years ago, the LGDA put on a patient and family conference that I was grateful to attend, and I learned a lot of things while I was there. But I will say two of the biggest takeaways were that there was a lack of access to care for adults, and it wasn't just me that was experiencing that. And then also the need for researchers to raise their own funding, which is not something that I knew or was aware of. And I think that the most important thing we can do is raise awareness of our diseases, but also these needs that we have as patients with rare disease. And I'm grateful for the LGDA. They, I think, have done a phenomenal job over the last several years to start raising awareness through their social media platforms and their fundraisers that they've done, including starting support groups and things like that. So that has been a big help for me. And I think continuing to move in that direction is really impactful. And I will say, when I was diagnosed, a lot of that didn't exist, and it felt very isolating until I found the LGDA and started interacting with this community. So I'm grateful for that community. And I think just the more we can raise awareness of what's happening in our lives and the needs that we have in terms of clinicians and care physicians that are willing to support us and work with us. I'm grateful that you guys are here and willing to learn more, especially if you're not familiar with CLAs and you're here to kind of gather that information. So thank you to the researchers and physicians that are here to learn about what we're experiencing.
Thanks, Amber. And Michelle, do you have any additions?
The thing that I think it's helped the most is it gave me information and a place to look that was a solid source, because you could Google and look up as much as you wanted. I could go there to reference. And then I like that if I go to a new doctor, I can say, here is a site you can go to, and it will show them more about it. Another good thing is like the social media aspect that Amber said, because I have become friends with a lot of the people that have my same disease, and they're all different ages. One of them is, I think she's like 22 now. So she is still not technically in the adult part. So we talk about all the challenges for her to get in. I did love the conference that we did in Dallas. That was right after my diagnosis. That was amazing. We met a lot of wonderful doctors. There was one in Spain that me and my husband had definitely talked about going to for a while. I'm trying to think of anything else. Those are probably that's my favorite things. But the challenges is really, if we could have a list of PCPs that were kind of in certain areas, that would help and have a little bit better understanding. And I know that we have some oncologists listed, but not all of them are listed that are willing to learn about it. That would be, a very nice to have too.
Thank you, Michelle. And I agree with all the points that you've made. So thank you both for sharing your personal journeys, your observations, and your hopefulness that really came across in your presentations. Your stories have provided us with great insight into some of the unique healthcare challenges faced by adults with CLAs, and that the LGDA community must come together to address. So we appreciate you, your time, and you sharing your stories with us today.
Thanks, Dr. Kelly.
Thank you.